Alrighty, we're going to go ahead and get started. Thank you everyone for being here today. This is the Emotional Wellness Webinar. It is part of our Impact Webinar series by Prostate Cancer Impact Alliance. These are hosted by the American Urological Association and hosted by the American Urological Association. And here we have Marty Chikoyan, who is our housekeeper, our moderator. And if you have a question for any of our panelists, please type it in the chat and we will tend to it. And if you're having any difficulties, please reach out to Dominique Henderson. Her email is right there on the slide. And without further ado, I will turn it over to Marty Chikoyan from Us Too. Marty?
Thank you so much, Vanessa, and thank you to AUA for sponsoring this webinar. Studies in both the United Kingdom and here in North America have shown that prostate cancer patients have a much higher incidence of depression and anxiety than the general public. That shouldn't be a surprise. But we've made tremendous progress in the last decade or so in treating prostate cancer. We perhaps have not made as much progress in treating the mental and emotional side effects of prostate cancer. So the purpose of the webinar today is to raise awareness of those issues and hopefully through the strength of our panelists to identify some ways to bring about some of those improvements. We do have a great group of panelists today, and I'll very quickly introduce them. I'll have to skip over some of their many accomplishments in the interest of time. But our panelists include Dave Horn. He's a 64-year-old retired attorney living in Seattle. He was diagnosed with prostate cancer in January of last year, had a radical prostatectomy in March of last year. Fortunately, no indication of cancer in any of the lymph nodes. And his PSA has been undetectable ever since. But David continues to experience the side effects that come with prostate cancer treatment. He has a long experience in battling depression and has made physical fitness a priority in helping to deal with that. Dave is the co-leader of Zero's support group for LGBTQ prostate cancer patients. Scott Davies is another prostate cancer patient, was diagnosed back in 2011, first treated with brachytherapy in 2012, and had a reoccurrence of his prostate cancer in 2018. That was treated with SBRT. Second reoccurrence discovered in February of this year, treated with cryoablation, and presently his PSA is being monitored by his oncologist, but at the last check-in, it was in the range of 6. So again, some issues to deal with for Scott. Dr. Artie Shelton is a 19-year prostate cancer survivor. He's an advocate for the Prostate Health Education Network. Dr. Shelton did his undergraduate work and received his MD from Howard University, did an internship and residency at Walter Reed Army Medical Center, received his fellowship training in adult and pediatric allergy and immunology at the National Institute of Health, Children's Hospital, and Walter Reed Army Medical Center. Dr. Shelton served in the Department of Defense Congressional Directed Medical Research Program as a consumer reviewer and advocate, and on the consumer work group there. During his personal venture with prostate cancer, Dr. Shelton has become aware of the magnitude of the disease that affects so many men, but especially its impact on African-American men. Jan Manwright is the Executive Vice President of Cancer ABCs, where she has developed patient-oriented education and support programs. Jan is a well-known and sought-after speaker in the prostate cancer community. I can personally attest to that. She's an author, an award-winning advocate, and has led patient helplines at multiple organizations. When her husband, Dominic, was diagnosed with advanced metastatic prostate cancer at age 58, Jan immediately became his advocate, researcher, and a major decision maker regarding his care. And to this day, she shares her lessons with others who are navigating a complicated disease in a complicated medical system. Finally, Hakeem Asadi is the founder of Beyond Living. He received his Master of Social Work degree from the University at Albany. His experience includes working with individuals living and coping with HIV/AIDS, mental health, substance use. Hakeem is a certified mental health first aid trainer, Bridges Out of Poverty trainer, life coach. Is also an integral part of the New York Model for Batterers program. He is the recipient of the 2018 In Our Own Voices LGBT People of Color Health and Human Services Award, serves on the board of directors with Hometown Health. Hakeem is a 2019 alumnus of the New Leaders Council Fellowship and has served as an adjunct professor of social work at Siena College. He leverages his experience as a social worker and a man of color to teach his students to lead with an open mind and an open heart. So we're very fortunate to have this panel with us today, and let's get on with our questions. I'm going to start by asking our patients. Dave, start with you. What are some ways that your cancer diagnosis affected your emotional and mental health, and how did that change during treatment or surveillance? Were there particular points where you experienced anxiety, depression, or other distress?
Well, Marty, first of all, I was stunned because I think of myself as a very healthy guy. I get a lot of exercise. I try to eat right. I thought of cancer as something that happens to other people when they get old, and I didn't think I was old either, although I was almost 62. I was depressed. I remember that I spent a lot of time curled up on the living room rug, having long conversations with my dog. And it was fortunate in a way that I was one of those patients who had to make a decision between having surgery or radiation. And so I had already shed my day job, so I went into full-time research mode for about 3 weeks, and that gave me something to do. But it was pretty depressing. I struggled with depression anyway, Marty, as you said, and particularly in the winter. So dealing with all this in January and February wasn't terribly helpful. How it changed, I guess, the worst of the depression lifted fairly soon. Once I had the surgery, I was able to get up and walk increasing distances pretty quickly. And that was all, that was good. That made me happy. I think the 2 points where that were the most anxiety inducing or depressing were, first of all, I went to a pelvic physical therapist for a while because I had some continuing urinary leakage, still do actually. And after a while, that process got to be kind of overwhelming. I was spending 2 or 3 hours a day doing these weird exercises. It wasn't really helping. And I sort of gave up on that and became discouraged even with doing the basic Kegel exercises. And then the other thing is just that as time went on, and I would say especially this year, and I realized that the urinary leakage was probably going to be with me, that erectile dysfunction was probably going to be with me, and that's continued to be a lot to deal with. Other than that, perfectly happy.
Yeah, thanks, Dave. And I think we'll hear much more about the fact that the after effects of treatment can be just as devastating, if not more devastating, than the original diagnosis. Scott, what about you? How did cancer affect your mental and emotional health?
Well, at first it was because my Gleason score was 7, I thought, okay, I'm, not at high risk, for in terms of where I was in the disease. So when I was first diagnosed, I thought, well, okay, we'll take care of it. I had skin cancer prior to my diagnosis, and I thought, okay, we'll just go and take care of it. However, and Dave, feel free to chime in too about this. Nobody tells you what to do after you've been diagnosed. You become your own researcher, or you have other people, advocate for you and help you with your research. But nobody really can give you a straight up answer about what you should do, which kind of goes contrary to going to the doctor, and where a doctor says, okay, you have X here, is medication, or this is what you should do. It's a very different scenario when you're diagnosed with something like prostate cancer. So that threw me a bit for a loop mentally. First thing I did was seek out a support group. And so that led me to us too. And that was immensely helpful. And we'll talk more about that in, I know, just a few moments. But I think what provoked the most anxiety after the diagnosis was just not knowing where to turn and who to turn to get information. And I didn't even, there are many, thank goodness, there are lots of alternatives for treatment and all sorts of treatment options. So, but given those choices, that can be also very overwhelming too. So I have to say, I was overwhelmed by the choices of options.
Thanks, Scott. And then you've brought up a good point. That the good thing and the bad thing about prostate cancer is that there are so many choices. There are a lot of great treatments available, but it's up to the patient to pick those treatments, and that can be stressful. I know we've had some technical issues. Has Dr. Shelton been able to join us?
Hi, Marty. Yes, this is Artie. How you doing?
Good. Thank you, Doctor.
Hey, how's everybody? Yes, I'm on.
Okay.
I heard your question. In regards to the prostate cancer, with the diagnosis, and I was diagnosed. I'm a 19-year prostate cancer survivor, and I was diagnosed in 2003. And what was interesting with me, Marty, is that I was kind of somewhat happy because my PSA was within the normal range, but was slightly elevated from the last year. And I really owe it to my urologist that said, Audie, well, because your uncle died of metastatic prostate cancer, you're African American, and you have a father that has prostate issues, I'd like to do a biopsy. And I thought nothing of it. We subsequently had a biopsy, and I was surprised about 2 weeks later when he told me that I did have prostate cancer, and I had a radical prostatectomy.
So you had that experience as a patient, but you're also a physician. You're a urologist, and so perhaps that.
I'm an internist.
Sorry, I'm sorry. Yes. So did you, when patients came to you with prostate cancer or other serious diseases, how did you assess their mental and emotional well-being as well as their physical health?
Yeah, as a physician, in our training, a lot of times we have patients that will come in to be seen for a medical problem, and we will find that it's, they may complain of headache or have high blood pressure or other illnesses, and we really find that there's some other stresses. And naturally, I'm with the organization with FEN, Prostate Health Education Network, under Tom Farrington. And from around 2003, 2004, I became an advocate, and that's where I was for the last 18 years, 19 years, have been talking to men about prostate cancer. Um, and what I found out is that in talking about the prostate cancer, is that there's a lot of emotional, concern. When you mention that to a patient that they do have prostate cancer, not just prostate cancer, but any cancer, but in particular prostate cancer, the man is concerned about his quality of life. In other words, we tell them that there's certain treatments, but then when you talk about the treatments, they basically come in and say, I feel healthy, but some of the treatment that you're recommending will cause me to have more side effects, such as incontinence, erectile dysfunction, and other things. So it really caused a lot of depression and sadness and anxiety on their part, as far as what should they do. I feel healthy now, but now you're telling me that the treatment may have some adverse effects. So I have to sit there. We sit and talk and discuss what are some of the options, and be very supportive.
Thank you. So has Jan been able to join us? I know, again, we had some technical issues.
Yeah, I'm here. Hi, Marty.
Great.
How are you?
Thank you. Welcome, Jan. Glad you could get in. As you can see from the question here, 3 things that put a particular strain on your emotional wellness while you were dealing with Dominic's 13-year journey with his metastatic cancer. What were those things, and how did you deal with them?
Yeah, it was a 13-year journey. So there were a lot of things that obviously that put an emotional strain on you. I tried to think of 3 that I could explain in a way that probably apply to a lot of people. Maybe I learned to work through. And I'm going to be honest, because the audience deserves honesty. And the first one is delivering the diagnosis information. And in my husband's situation, he had a tumor in his thoracic area, which they had to remove by emergency surgery. He was temporarily paralyzed from laying down on his back. It's a long story, but we received the cancer diagnosis in the hospital with my 9-year-old son sitting in a chair next to his daddy in a bed. And the surgeon walked in and wanted to talk about the tumor. And we all looked at him. We didn't know what he was saying. And he said, well, you have cancer, right?
Huh.
And my little boy didn't know. My husband didn't know. And I didn't know. And I think, honestly, there should be some training in medical school about how to deliver a difficult diagnosis, a cancer diagnosis, a life-threatening diagnosis to the patient and the family. Or there should be more access to social workers, oncology social workers, to help in these situations. So in addition to everything else that we were dealing with, now I had to help my little boy. Now I had to process this and then help my husband. The way the diagnosis was delivered lacked understanding, training, and even, the doctor was a nice person. It was delivered very poorly. And I bring that up because I've heard this with a lot of other people too. I think that we can definitely do better there. And I think it has to do with training and education. The second one that I came up with was honestly misinformation from a doctor sometimes. And again, I'm going to be honest, and I'll give you 2 examples. One was that when my husband was on Lupron and was responding, which is hormone therapy, and he responded for a while, then his PSA began to come up, which is very typical in many cases. We were told by a surgeon that the next treatment for that would be orchiectomy, which is surgical removal of the testicles. I knew that wasn't right. I didn't think it wasn't correct. But if we had just followed the surgeon's advice, this would have happened to my husband. The second situation is my husband had bone mets in his entire spine, his bilateral ribs, his pelvic area, and his skull. And we were told by a surgeon, a geriatric surgeon at an academic institution, that Zometa and bisphosphonates were of no value to him. So I thought that doesn't sound right. So I found myself in a situation where I had to follow my instincts. I want to validate to caregivers to follow their instincts and patients. Your instincts are almost always right. I'm not going to say 100%, but almost always right. because nobody cares about your family like you do. And turns out both of these pieces of information were incorrect. And so it begins to chip away at your trust. And so that has a toll on your emotional well-being. I learned to research better. I learned to read my husband's medical records. I learned to use Google as a dictionary for the terms in the medical records, not an encyclopedia, but I learned to become a better researcher for my husband personally and his personal cancer. And that was, quite frankly, like therapy for my emotional stress, because I began to feel like I understood the next couple steps instead of being overwhelmed and helpless. So that was my journey. So
Thank you.
there's
Yeah,
two.
that's a powerful story, and
Thank you.
I'll have some more questions for you later. But thanks, Jan. Hakeem, you're a mental health professional. Do you see cancer patients as part of your practice, and what do you learn from them, and what do they learn from you?
So yes, I do. I think I can echo much of what was said already. Is just giving a space of authenticity and to explore these changes in life. And so working through navigation of grief, right? So those stages of grief where we have those questions, where we may feel depressed, where we may feel anxious because there isn't information, we don't know a whole lot. And in doing so, giving folks permission to ask the questions. I think there's a lot of times where we don't ask the questions because we don't know the information, right? So the doctor is the person who knows the information, is giving the treatment plan and things. And so with patients, it's how do we empower you to walk into the office, and if we're confused, ask the questions, ask for clarity, because much of anxiety is connected to fear, which is rightfully so, right? Because the life that we knew, or the life that we know, has now changed. And so with that, how do we gain clarity? How do we advocate for ourselves? How do we find the social workers, as Jan said? How do we process this in a way that's conducive to me feeling healthy, me feeling secure, me feeling a bit better moving forward?
Thank you. Dave, so getting back to your cancer journey, we don't want to get into a long critique of our so-called medical system here in the United States, but are there particular barriers that you experienced during your treatment that affected your mental health? If so, how were you able to address those?
Well, I wouldn't say I didn't face a lot, but in my support group for LGBT prostate cancer patients, I hear over and over again from guys whose doctors don't want to talk to them at all about sex or about the effect of various forms of treatment on their sex life. I'm not sure why you'd become a urologist if you're squeamish about sex, but apparently it's pretty common. And some feel that their doctors just don't accept gay people and aren't comfortable with gay patients. And I'm lucky. I have great insurance. I live in Seattle. I have great doctors. It's not an issue. But people around the country, it's a big deal for them. They've got this problem, and this big problem. They're expected to figure out how to solve it, and they don't know who to turn to in what feels like a hostile world in lots of places. So that's a pretty big problem that I hear about people facing.
Thank you. Dr. Shelton, so I know that you are an internist, not a medical oncologist, but in 2014, the American Society of Clinical Oncology adopted a guideline that recommended that all patients with cancer be evaluated for symptoms of depression and anxiety at periodic times across the trajectory of care. Do you think that a similar guideline for urologists or other medical professionals would be beneficial?
Yes, Marty, I think without question, as we mentioned about the suicide ideation, of cancer patients and also specifically of prostate, cancer patients, where 2 to 4, patients, we have an increased rate about 2 to 4 suicide from urological, from patients with prostate cancer. I really think that we should be following those guidelines. Once we've been given the diagnosis, when the social worker was talking, I believe Hakan, he was saying have questions and notes, because I remember during my journey with the prostate cancer, once my urologist confirmed that I did have prostate cancer, I don't remember anything else after that. The anxiety, the depression, or whatever you want to call it, being scared, I couldn't remember anything. And I really think that, that as a patient goes in to talk with the urologist, they should have their wife or significant other with them to take notes, and also to remind things, because I had to talk to my wife later on and say, tell me what happened, because I was totally in shock. But in regards to the urologist, you mentioned in regards to, and I think it was Dave also mentioned that some of the urologists, they do not want to talk about some of the erectile dysfunction. These are things that can be very, very important, because when you talk about prostate cancer, we talk about a couple's disease. So that's really important. But coming back to the American Society of Clinical Oncology adopting the guidelines, that they should talk with the patient, because it's a very heavy burden when you tell somebody that they have any type of cancer, but prostate cancer, because as I said before, you're impacting on usually the individual is somewhat healthy, unless they have more advanced disease, and so you're telling them that they're healthy, but yet the radiation is going to cause some additional problem with depression or anxiety. So I really think that we need to have more compassion of the doctor, the urologist. Some surgeons can be very I'm trying to find the right word because I don't want them to beat me up. A little insensitive. We as internists, we're more compassionate, and so we'll find different ways of trying to lessen the burden of saying that you have cancer, and make it more optimistic that we have treatments that are going to take care of you.
Thank you. So let's follow up on that a little bit. So Hakan, if a urologist or other medical professional were going to try to assess a patient for mental or emotional issues, how would he or she do that? Can you tell us the difference in signs or symptoms, anxiety, depression, some treatment strategies for each of those?
Sure. So first, let's break down the difference between sign and symptom. Signs are things that we can see. So I often talk to folks around listening for what's not being said. And when we're doing that, we're being intentional about listening for those things. Symptoms are anything that someone's expressing or visible, or actually it's a part of the person's expression. And with that, I think breaking it down to the 4 L's. So if we're listening for what's not being said, the 4 L's, if it's impacting someone's, the way they live, the way they laugh, the way they love, and the way they learn, then we can ask additional questions around anxiety, depression, some type of emotional wellness assessment, because these are the things that how we show up in the world, right? And so if these are impacted, the way we live, the way we laugh, the way we love, the way we learn, these are impacted, we can see that something else is going on. There's some distress here, there's some anxiety here, there's some depression here. And those follow-up questions can help tease out what's going on. And so the treatment that I use, my go-to is cognitive behavioral therapy. And when I work with folks, we take a deeper dive into our thoughts, into our emotions, because there's cognitive behavioral therapy talks about the interconnectedness around our thoughts, emotions, and behaviors. And so often we don't pay attention to our emotions, and so often we don't pay attention to our thoughts. And so how we do that is we take a deeper dive into what the emotional experience is. I often use a feelings wheel with folks to kind of identify what we're feeling, what the emotion is, because it gives insight on what's going on. So often we suppress our emotions. We don't actually listen to them. We don't make use of them. We just kind of bypass them. And that can be more challenging, because then our behavior shifts, right? So we become more isolated, but we're not thinking about the reasons why we're isolating. or we become more angry, but we're not thinking about the emotions or the thought process that happen that makes me a little more angry. So signs and symptoms, 4Ls, those are my go-tos. If it impacts the way we live, the way we laugh, the way we love, and the way we learn, and then asking additional questions around that.
Thank you. I love the 4Ls. Before we move on, I just want to ask you a real quick follow-up question, very briefly. Is there a particular assessment tool that you would recommend that either primary care physicians or urologists use to assess, objectively assess, or in other ways, assess the mental and emotional health of their patients?
Yeah, absolutely. There are a few tools out there, the PHQ-2 for starters, and then if there's a particular response that says we may need more information, there's a PHQ-9 that speaks to the depression. But so often those tools are, folks know how to answer them. And so I always stress, in working in healthcare, pay attention to what's not being said. I think that's so important. And I think that relationship is so important because folks know how to answer those questions to not come off as, air quotes, crazy, right? We've navigated the system in a way that we know what to do and know what to say. That way we don't, it's just the nature of the beast. And so I think that's why it's so important to have a relationship and ask those follow-up questions, because you're listening for what's not being said.
Great, thank you, very helpful, appreciate that. Scott, so aside from the cancer itself, what else causes stress or anxiety? Side effects, family, friend reaction, finance and insurance, all those things that we have to deal with. What did you find added to your stress as a patient?
I would have to say all the above. All of those things that are listed here have been at one time or another a source of stress. The side effects, saying goodbye to how you were versus how you are today, that is stressful, because basically after a cancer diagnosis, such as with prostate cancer, you have to say goodbye to your former self, your yesterday self, and deal with what is happening today. And so you have to confront today head on and also learn to live in the moment. So that may mean in terms of relationships too. I mean, for me, what's paramount is addressing relationships because they're the most important thing, I think, in life, and so for me, maintaining connections. Now, that said, when you have any sort of disease that throws elements of, shall I say, reflection, self-reflection. So you don't know necessarily if you're sharing too little or too much. How do we monitor ourselves in terms of our own reactions to our disease? The last thing I want to do as a patient is be a burden to anybody. Be a burden to my doctors, be a burden to those around me. And so I'm very cognizant of how I'm dealing with all of that. And of course, you're looking at the financial elements too. This, as we know, the treatments are expensive, and even with good insurance, you still are paying a lot of money. And of course, there are lots of iniquities surrounding all of that too. And so I think another thing that I have found, since I have had recurrences, Marty, what is stressful is, where do I go next? Who do I talk to next? And not knowing, I am blessed with a great urologist. it's funny because we've kind of cycled back where I've been working with him, thanks to my cryoablation. So he's the one who originally found my cancer, and then I left, his practice to go to be treated elsewhere. And now, 10 years after my initial diagnosis, I'm back with him, or I was back with him for the cryoablation. So, it's a bit of a dance, how we dance and who we dance with.
Right.
So the specialists, you cycle in with one set of specialists, you cycle out, you go to another set of specialists. And I did not have a medical oncologist until just this year. So now I've brought a medical oncologist on board my medical team. So is that,
Right.
does
I
that
mean,
help
it's not,
answer the question?
it's not just a dance, but you have to keep changing partners. And
Exactly.
I love the comment about you don't want to be a burden to your doctor. Wow. Dave, do you have anything to add to that?
I would just say the relationship with one spouse or partner. I've seen lots of people go through all sorts of ups and downs. I've seen couples split up because they couldn't handle it. So, that's a definite area of concern.
Thank you. Dr. Shelton, so I guess the question sort of speaks to itself. In your years of medical practice, what advice did you find helpful to give to patients and to caregivers about the potential impact of a prostate cancer diagnosis for prostate cancer treatment?
I usually try to comfort them, to tell the prostate cancer patient and also the family or caregivers that usually, with good care, as we talk about with Scott and David, that with good care, the prostate cancer can be a slow growing, type of cancer, and that we do have different, treatments that we can, really control, the progression of the cancer. And so I really think that's really important, that we have to let them know that we're going to be able to manage them and manage a lot of their symptomatology, and that there's a lot of resources. There's resources, and I think one of the key resources, talking with the different advocacy groups, where you're talking about Zero or any of the other advocate groups, Prostate Health Education Network, that you really, if you talk with some of the advocacy groups, that they can really assist in providing advice and support, to the patient and also to the caregiver. So I really think it's important that they really, between the church, and also with different advocacy groups, that'll be really important to talk with them.
Thank you. Yeah, I will add to that. I think one of the most important things that we say to newly diagnosed patients when they come to my support group and other support groups is, hey, you're not in this alone. Cancer
Right.
is a very lonely disease, and there are people, there are groups that are ready to walk that journey with you, and that can be a huge benefit. And speaking of the support groups, so Hakeem, you facilitate a support group for Black men with prostate cancer. Are there some unique mental health needs for that group?
Yes, I love the group. It's always interesting working with folks who are, how do I want to say this? Where stigma is a little bit more challenging, and that vulnerability is a little bit more challenging in the sense that this is something that we don't generally talk about, because one is healthcare, but then also the connection to prostate cancer. And so the uniqueness of this group is the sense of community that comes out of it, the vulnerability that the men share with one another, the questions that come up, because initially we didn't talk about emotional wellness. We didn't talk about mental health, because I know working with Black men, we have to be very creative in talking about mental health and emotional wellness, because that's not something that we talk about often, right? There's stigma that's connected to it, and there's mistrust that's connected to mental health and healthcare in general. And so initially avoiding it, it actually just gradually came up because as a facilitator, I'm not the one talking. I'm just kind of like guiding just in case we need to, take a detour, take a direction. But in that guidance, emotional wellness came up. Someone brought up grief. Someone brought up anxiety. Someone brought up, the challenges the strain that it's having on my marriage. And so I found that it was a unique opportunity to take a deeper dive into emotional wellness. How do we process our emotions? How do we talk about our emotions? Because one, working in the field, I know that emotions and depression and anxiety show up different for the Black community. And so being aware of that, acknowledging it, and giving space for it to breathe, giving space for people to just air it out, and then also giving tools to ways to process it. So the sense of community, I think, is at the foundation is helpful, that folks can feel seen and feel heard in a space where they are with people who look like them. Because other times when we're out as Black men in community, there's already a guard that's up. There's already a wall that's up. And so feeling safe enough to share, I think it is a unique opportunity to actually take a deeper dive into mental and emotional wellness for the group.
Thank you. I'm going to ask Dave the same question, and then Jan, I think, has a comment as well. But Dave, I know you have, you mentioned that you facilitate a support group for gay and bisexual men. Anything to add to the comments that Hakeem has said about his support group?
Yeah, there's a lot of isolation. There are people who were supposed, their doctor strongly recommended surgery and they didn't have surgery because they didn't have anybody to take care of them if they got home when they got home from the hospital, or something about their insurance, or you see people postponing treatment sometimes for years in the hopes that they'll be able to afford it. Some people get suicidal, and then I think just the sense of isolation and rejection sometimes by people's families. Even in my age group, there are gay men whose families want nothing to do with them. That makes it harder. And then trying to, for some guys, it's a challenge to find a doctor who's not homophobic.
Thank you. And Jan, you have a comment or a question? Go ahead.
Well, yeah, I'm part of the panel. We're speaking about caregivers, and so I wanted to just share a couple things that I thought might be helpful and make sure we're speaking to caregivers too. Wow, I mean, I learned a lot in the journey, right? So I learned immediately that I handled the doctor's appointment different than my husband. And I had to begin to understand that it's instead of expecting him to be like me. And again, I'm speaking to caregivers who go through this also. And I learned that with the struggle and trying to work the medical system and even the misinformation, I needed to make sure that the appointment was about my husband at all times, that it was about the cancer patient. So I always wanted to make sure I was advocating for the cancer patient and not against anything, not against the misinformation or against the doctor. So that helped me quite a bit. I would learn to go in and state my questions in my research. I'm sorry, I have some background noise. Can you hear it? Is it okay?
It's fine. Yeah, go ahead.
Okay. All right. And then I would sort of pass the baton to my husband and I would say, honey, what do you think? And then let him talk to the doctor. I would learn to bring in medical records instead of assuming the doctor had them when I got there. So I was prepared both verbally and visually. I would give him the medical record that I was referencing, whether it was a bone scan or a blood test. That helped the appointment a lot. I also walked out of the room more than once just to go get a drink of water, whatever it was, so I could give my husband time alone with the doctor because I was always there. So I wanted to make sure he had those pieces of time where he could talk more frankly with his doctor and I wasn't there. So there's ways you learn eventually to work the doctor's appointment for the patient. And that took a little while, but as I learned to do that, it helped a lot. And your husband's not going to change, but you can learn in the journey as you go. And I did learn that men tend to handle the conversations differently with the doctor. So those are just some things I learned. I'd also like to encourage every caregiver to give yourself permission to be who you are as a caregiver. We talk about every patient's different, every caregiver is different. And it's going to depend on your relationship with your husband or with your partner. Every relationship is different. So give yourself permission to be who you are.
Thank you, Jan. That's really great advice. And I'm glad that we're touching on the caregivers here as well as the patients. We're starting to run out of time, so I'm going to ask everybody to be fairly brief in their responses. But Dr. Shelton, tell us how patients and caregivers have expressed to you the emotional impact of their prostate cancer as a physician.
I'll be very brief. The emotional impact of the way they express the emotional impact of their prostate cancer is somewhat being overwhelmed, because once they're given the diagnosis, I think many of us on the panel will understand that usually the urologist is going to give them an opportunity to be seen by the surgeon, the radiation doctor, the surgeon, and possibly the oncologist. And for a person that's been newly diagnosed, it gets to be really emotionally impactful, because this is all new to them, to say whether they should have surgery and what type of surgery should be robotic. If they have radiation, should it be the cyberknife or the seeds? And this to me creates a lot of emotion for a patient, because it's all new to them as far as, about the treatment and also the side effect. So I think it's very important when we look at some of the advocacy groups that we have individuals in each of the different advocacy group that have had the different types of treatment, that we can then allow the newly diagnosed patient, prostate cancer patient, to talk to somebody and get a personal insight as far as what was their experience by having robotic surgery or radiation or hormonal therapy. And so I think it's really important to help alleviate some of the emotions they may have by being diagnosed with the prostate cancer. And then I think another significant impact is when somebody is told they have a very low grade prostate cancer, and then have to, active surveillance, and where the patient saying, so you're saying do nothing, so I mean, there's a lot that has to be, we have to do a lot to support the prostate cancer emotion by providing a lot of information and a lot of resources. And I think this is where a lot of the advocacy groups, can really help out.
Thank you. Hakeem, you've talked about this a little bit, but maybe you can summarize some of the common issues that cancer patients face.
Yeah, I think again, that navigation of grief, or the stages of grief. So where are we at in that? But then there's one thing that I love talking to folks about is there's ministry and presence. Sometimes I just have to listen. Sometimes it's just a space for folks to talk about and process and air it out. There's not a lot that I need to say and do in these moments of just having presence with someone, as they filter through these questions, as they filter through what is life going to look like, as they filter through some of these fears. And so then we can process some of the fears and some of the concerns. But at the root of it is just ministry and presence, just sitting with the person, giving them space.
Great, thank you. I'm going to ask our two patients first, Dave, and then Scott, some mental health resources. By resources, I don't necessarily mean therapists or that kind of thing, but what have you done for yourself that has helped you with your own mental and emotional health, and that you could share that with others? So let's start with Dave.
Marty, I go to the gym 3 or 4 times a week. I walk 2 or 3 miles a day. I take 75 milligrams a day of sertraline. I spend an hour a week with a psychiatrist. I don't drink anymore. I get lots of sleep, and I still get depressed sometimes. Oh, and I spend an hour or half an hour a day with I call it a happy light. It's a seasonal affective disorder remedy, I guess. But yeah, so my life is largely built around avoiding depression, and I've become pretty good at it.
Thank you. Scott, what are your techniques or resources that you draw on for your own mental and physical health, or mental and emotional health?
I try to stay as active as I can. And I use the word active broadly. So for instance, like Dave, I like to exercise, I go to the gym, and I also love being out in nature. I find nature to be incredibly therapeutic and soothing. And there's the Japanese term Shinrin Yoku, which literally means forest bathing. So I love going out into nature. I also love, I think it's important to stay connected to others. So I find that one thing that is very therapeutic for my own well-being, emotional well-being, is just helping others and expressing compassion toward others. So if I can help other people, that helps me. I just feel better, in my sense of purpose in life. So serving others is very important to me too.
Thank you. I'm going to throw that same question to Jan. If there are some resources or strategies that you found that that helped you with your mental and emotional well-being during your journey with your husband.
Yeah, honestly, to be candid, I had a great group of friends that would pray with me and pray over me when I was just overwhelmed. That was a big thing. Just being able to talk to somebody and get my thoughts out was also very helpful. I saw a counselor during that time. Learning to pick your battles. I actually would. I was just talking to somebody about this today. I would pray sometimes that my husband was the most important thing. So I really needed someone else to take care of 2, 3, and 4, so I could do number 1. And some of those things were very helpful for me. But the thing that would help me the most, let me make a quick comment about people who want to help you, because this happens a lot. Friends and family, they want to help, they don't know what to do. I'm going to give you just a real simple thing. Just ask us, how can I help? Sometimes people want to give advice because they're fearful and anxious too, but we're dealing with our own fears. And really the best thing you can do is just say, how can I help? It means a lot. So.
Thank you. I see that we're out of time, and we want to leave a few minutes for questions and answers. So we'll shift to that and ask people to type their questions in the chat box. We have one already from John Antonucci, and I'm not quite sure how to put this in a question, but that there, I guess maybe Dr. Shelton, do you find, or did you find that patients had a fear of asking you questions? You know, that because of the doctor-patient relationship, maybe sometimes lack of trust, was there a fear of asking questions? And if so, how did you try to overcome that?
Marty, I think as Jan and some of the other panelists were saying, I think from body language, I think patients can really see what type of physician or healthcare provider you are. And so I'm very open, and I think just from my personality and attitude, they, and I encourage them to ask me anything that they feel that's important. And I really welcome when I meet with them, for them to bring their spouse, significant other, or someone with them, so that we can have an open discussion. And one of the things, I was military, and we, therefore, I didn't have to worry about seeing somebody every 10 minutes to get paid or anything like that. If I felt I needed to spend an hour with somebody or half an hour, I would do what was needed to really answer all the questions of that patient. So I really feel that just being there and for the patient, and being available and being open, I think it can alleviate a lot of the anxiety. So I think that would work out. That works out pretty well. So just being open with the patient.
Thank you. Jan, you have a response to that as well?
I do. One of the things I learned to say is better questions will get you better answers. And in my husband's journey, I stopped looking for answers and I started looking to see if I was asking better questions or the right question. So I worked on developing my questions more. So that's one of the tips I give people. It's sort of a switch in the way you're thinking. And that came from digging into his medical records, to be really fair. I also tell my callers and the people I work with to talk to the doctor about the treatment, but the nurse about the side effects. It tends to, I don't know what it is, but nurses just are really good with side effects. And I also encourage them to talk to their pharmacist. People don't know that to be a pharmacist, you have to have a doctorate in pharmacy, and they're often available 24/7. So there's more places to ask different questions, and sometimes that can be very helpful.
Great suggestions. Thank you. Here's a question for Hakeem. So when professional help is needed, what are some considerations for patients or caregivers in sourcing a therapist? How do we find a therapist?
Excellent question. Because so often access to care is very challenging. So I tell folks if they want to look for therapists through their insurance, go directly through your insurance. There's information on the back of your insurance card to look for directories, to go online, to ask questions and filter it through that way. The other way is there are directories online that are outside of your insurance. And so when you do that, in your search, be specific as possible as to what you're looking for. And understand that the first therapist might not be the first one. So giving yourself permission, I should say, to get a new one. And ask those questions. I love what Jan said, asking better questions get better answers. And so asking the questions that you need to filter out when you're looking for a therapist, I think that's important. But there's through your insurance, but then there's also directories such as Psychology Today, that helps you narrow it down to your zip code to see if someone is there. And then you get to narrow down that I want a male, I want a female, I want somebody who knows and talks about anxiety or depression or LGBTQ issues or other things like that. I think that's important, just to give yourself permission to know what you want and seek it.
Thank you. I think that's a perfect note to close on. And, we might not have all the answers, but maybe we've learned to ask some better questions. So I want to, first of all, thank the panelists for joining us today and for the great responses and the wonderful information that you provided. And my thanks to AUA and the staff, particularly Vanessa and Jayla and Diane Monique for helping to put this together. Turn this over to Vanessa to close us out.
Thanks, Marty, and thanks to our panelists. What a great session. So here, a special thanks to our sponsors that are here on this slide. And thanks to everyone. I hope everyone has a great afternoon.
Thank you.
Thanks. Have a good day.
Good day. Thanks, Marty.
Recording